There are about 26.4 million cases in the US right now, with more than 446,000 deaths. They are saying, however, the trend is going down, the cases are going down. My question to you is, how are you observing these numbers, and are we on the right track of going down?
So definitely it looks like the cases are going down, and that's because of that surge that initially happened after the holidays. After we had Christmas and New Year's, we noticed there was a surge in cases as people were coming together in their homes or with others in social gatherings, and there was a spike, and now we're seeing the end of that surge.
Right. What do you think was the biggest reason behind that surge, doctor? And today a study came out saying that young adults from the age of 26 to 49 could be responsible for the amount of surge we saw. What is your comment?
So I think from the information that we have from the CDC as well as some of our health experts, we know that some of these increased cases have come in as a result of some of these smaller gatherings that people tend to think may not necessarily be so bad. They think that they're safe because there's only maybe 10 people in their home, but in fact these are the causes for why we're seeing some of these surges and increased transmission throughout.
We are seeing about 3,000 deaths per day. How do we understand that?
So as we see more and more cases of COVID, there's of course going to be a potential for an increase in deaths related to COVID as well. The good thing is the death rate isn't anywhere close to what it was when this pandemic first started, and that's due to us understanding more about this virus, about the transmission of this virus, and having more options available to patients in the hospital.
Definitely. Let's now talk about the COVID-19 hotspots, doctor. There are various hotspots across the country. Hopefully and thankfully, New York is not one right now. What should these hotspots be doing, according to you?
So really the same thing we've been talking about since the beginning of this pandemic. We know that social distancing measures, they work. We know that they work to help decrease the spread of COVID-19. So hand washing, staying home when you're sick, wearing a mask, all of those things are extremely important to be doing at all times during this pandemic.
Right. And let's talk about the restaurants real quick, doctor, because today the news came out where New York City will reopen their indoor dining starting February 14th. My question to you is, we were once the epicenter of this disease. Do you see that as a safe thing to do? And also, could we potentially be an epicenter again?
So, when we look at indoor dining, that was a cause for some of these increased cases of COVID-19 during the pandemic. So, of course, there is a risk that's associated with indoor dining, though that risk may be lower now than it was previously. So I think that our government is doing the best that it can in terms of trying to make these reopening of restaurants and rather indoor dining be made in the safest way possible. So they're trying to maintain social distancing, they're trying to maintain improvement in air circulation, but nonetheless, it is not zero risk to go out to a restaurant and indoor dine. So I think it's really important to think about your risk. For somebody who may be high risk of having COVID and maybe having hospitalizations or severe COVID, if they do contract the illness, they probably should consider avoiding indoor dining at this time. But for other people that might be lower risk, they can think about it in a different way, but they still need to try to be as safe as possible.
And those guidelines are so important. I just have a quick follow-up question with the guidelines. Dr. Anthony Fauci has said that double masking is not harmful, could add a protective layer. What is your comment on that?
So we know that one mask can potentially protect us from COVID-19. So the thought is that wearing two masks might be even more protective. There's no great research or studies that really justify those findings. It just seems to be common sense. So if you have the means of being able to wear two masks at a given time, that might help protect you even further by decreasing the likelihood of either transmitting the virus through the mask or coming in touch with the virus from respiratory droplets from the outside.
Right. Let's talk about the COVID variants, doctor, because it's concerning experts nationwide. My question to you is, how many variants are there right now? What do you know about them? And what is their impact on the surge of cases as well as the vaccines?
So So as of today, we know that there's 3 variants that have been identified in the United States. One that comes from the UK, known as the UK variant. We have a South African variant, and we have a South American variant. In terms of what we know about these variants and where they're spread in the United States, it seems that the UK variant is the one that's most commonly seen amongst the 3 of them, and the Brazilian variant, or that from South America, is the least seen. We've only had 3 cases of that reported thus far. We really don't have enough data in the United States to understand much about these variants, but we do have data from the countries that they came from. So we know that in these other countries, there's probably a higher risk of transmission related to such variants. And that's concerning, because if these variants are highly infectious, then they can transmit very quickly from one person to the other, which means that we're going to see an increase in the cases of COVID. We're also going to see an increase in hospitalizations related to these variants. And so the best thing that we can do is try to limit our exposure to these variants as best as possible.
Doctor, experts are also saying that these variants could infect a person who's had COVID-19 before. Have you seen that so far?
So we know in general that reinfection rates from COVID-19 are extremely rare. We don't really know in our population what exactly that reinfection rate is, but from the data gathered from organizations like the World Health Organization, there's only been about 30 or so cases of reinfection that have been mentioned in the literature. So we really don't know much yet, but only time will tell. When it comes to these COVID variants, I think we're getting concerned because there's some data that's come from our colleagues living in South Africa, for example, who stated that there is a potential for increased reinfection with the South African variant.
Right. Let's now talk about vaccine, doctor, because a lot of questions are there about the vaccines, they're working, and how important they are. Tell me about the fact that why the vaccine rollout is so slow. What have you seen in the medical community? What are you hearing about this slow rollout?
So I think one of the major issues related to the rollout has to do with supply. So we knew that even before the vaccination rollout process began, that right now, unfortunately, the supply of vaccinations that we have from the 2 major suppliers, Moderna and Pfizer, just can't keep up with the needs and the demand of the population. So we know that even from CDC data, looking at the population that was in phase 1 and phase 1A and phase 1B rather, that was going to be close to almost 80 million people. And we know, as of data from the beginning of February, that roughly about maybe 24 million or so Americans have received the COVID vaccine thus far. So there's a large number of people within even just our phase 1A and 1B population that have not yet received the vaccine. And that's just because we don't have enough of the vaccine to go around. As you know, Aditi, we have each vaccination requires 2 doses. So even if we have 100 million vaccines available, that means that we can only really vaccinate 15 million people. So we need to somehow rev up supply, and there has been some positive light in relation to that. The thought is that Pfizer and Moderna have told us that maybe they'll be able to secure up to 200 to 400 million additional doses as of June of this year. But unfortunately, that's more time. It's not going to happen tomorrow. So what's important is that we all do the right thing by trying to maintain our distance from each other, try to wear our mask, wash hands, and stay home when possible.
What, according to you, should the federal government be doing when it comes to the vaccination program? Because there has been a huge call for a national plan for these vaccines.
I think the most important thing really at this time is that we need to really work on supply. I think we have, supply from 2 major pharmaceutical companies right now, but it's just not enough. So the hope is that more and more companies will come up with different vaccination options. We have a few on the horizon already that will allow for us to increase the supply of the vaccines to meet the demands of the people. I also think it's important to look at certain areas where there are hotspots within certain states, for example, that they know the infection rate is very high. Those are places that maybe we need to consider targeting, because that's where the infection is going to spread, and it's going to spread to other areas very quickly. So I think in terms of supply and in terms of distribution, these 2 goals should be met to try to curb the cases as well as to help protect a larger number of individuals.
Does it matter which vaccine we end up getting? What is the efficacy of both of the vaccines?
So both the Pfizer and Moderna vaccines are what's available right now, and they're both equally as efficacious. So if you can get either of them, you should definitely consider either of those vaccines. Really, the only negative in relation to Pfizer versus Moderna is Pfizer needs to be stored at ultra cold temperatures versus Moderna, which can be stored at just freezer temperatures. And as we know, the Pfizer vaccine is offered to people 16 and over versus Moderna, which be given to 18 years and over. So those are the main differences. In relation to the side effect profile, I would say that my colleagues who've received the vaccine as well as other individuals, really the side effect profile is pretty similar between the both of them.
Right. And just talking about the vaccine, AstraZeneca says that its vaccine appears to reduce transmission of the coronavirus and can protect up to 3 months with just one dose. How are you looking at this? What is AstraZeneca trying to do?
So I think it's really promising data that came out with the AstraZeneca trial, because most of our studies so far with vaccinations have been looking at efficacy, meaning how effective is this at preventing COVID-19 infection or hospitalization or severe disease and hospitalization and death. But this is the first time we're actually looking at transmittability data, meaning what is the likelihood of somebody who's been vaccinated actually being able to not transmit this infection to somebody else. So in some way, it's nice to see some data in the realm of transmission, because it really hasn't been looked at thus far, but we just don't know exactly what the data shows as of yet. This is new study that has, just recently been shown to the public. So once it's come under peer review, I think we'll learn a lot more about how they were actually understanding transmission. Was this the way that we should look at transmission data to be able to really say that this is a conclusive result?
Right. I just have 2 more questions left here for you, doctor. I have to ask you, you are an endocrinology specialist and you deal with a lot of at high-risk patients, especially South Asians. Have you seen any interaction between COVID-19 and these patients, and how concerned are you about them until they get the vaccines?
So I'm very concerned about our South Asian population, mainly because, within our South Asian community, things like diabetes, heart disease are quite rampant. And we know that diabetes and heart disease are 2 major comorbidities that can increase one's risk of having severe COVID infection and death. So I think it's extremely important for those people who are considered high risk to really be careful, to make sure that they're staying home as long as they can, to make sure that they're wearing a mask whenever possible, to make sure that they're doing all social distancing measures like washing hands, etc., to make sure they decrease their risk of having COVID-19. I think, we've been in this pandemic for more than a year now, and people are suffering from what's called COVID fatigue. It's really easy to just let down your guard. You're with your family members who happen to be visiting, and you only have 4 people in your house. Maybe you feel comfortable because they're your family to take off your mask, but really that's not the right thing to do. You can only take off your mask around people that are within your quarantine team, people that you're living with, and anyone else coming from outside, they need to be looked at as a potential source of COVID-19, and you need to protect yourself.
Right, and I think in some states, they're allowing people that have diabetes and other conditions to be vaccinated first. What do you think about that?
I think it's extremely important. I've just seen so many of my patients, suffer and die even from COVID. And it's something that I believe, potentially we could have prevented. And so if you have the potential and the opportunity to be vaccinated, I definitely think that people should strongly consider that.
And finally, go for it.
I was also going to say one thing that we forget about often is the monoclonal treatment that's available for patients when they develop COVID-19. And so there is a monoclonal therapy that's available in certain institutions, certain hospitals, where if you have mild to moderate symptoms of COVID-19, you can call your doctor and see whether or not you'd be a candidate for a monoclonal therapy. This monoclonal therapy in studies has actually been shown to decrease hospitalizations and severe severe COVID-19 complications. So in some way, it can really save someone from having a catastrophic outcome from COVID-19. So if you're sick with COVID, if you have diabetes, if you have heart disease, if you're over the age of 65, you have other comorbidities, and you just tested positive for COVID, you're somewhat sick, I would recommend talking to your doctor about considering monoclonal therapy.
Right, definitely. I hope the audience takes all this advice. I would love for you to give one last advice to all of us, and especially the young adults.
So this pandemic, unfortunately, it's not over. There is a light at the end of the tunnel with this and with the introduction of vaccinations. But I think it's even more important now than it's ever been to still, stay strong and maintain all social distancing measures. Continue wearing a mask, wash your hands, make sure that you're staying at least 6 feet away from others. We know that social distancing works to prevent the spread of COVID-19, and that's what we have to live by, and that's what we need to do to guide ourselves every day.
Dr. Adimoolam, thank you so much for your time here on ITV Gold.